abdominal assessment. I'm going to be looking at your abdomen. I'm going to be looking for the contour of your abdomen, looking for general symmetry, looking for any pulsations, any problems with the umbilicus, any redness, looking at the skin, looking for any bulging to see if there's any umbilical hernias. The skin looks nice and contour, no lesions or different colors in the skin. Then I'm going to go ahead and do auscultation of the abdomen, listening for bowel sounds. We're listening in all 4 quadrants, and he has very active bowel sounds. I'm also going to be listening for the vascularity, listening to the aorta to see if there's any bruits, listening to the renal arteries, listening to the iliac arteries. And then I'm going to go ahead and percuss the abdomen in all 4 quadrants, listening for the sound, which should be a tympanic sound. Noting if I hear any dullness. And then I'm going to go ahead and percuss the borders of the liver. I'm going to start in the 4th intercostal space, mid-clavicular line. Dullness there. Probably about the 4th or 5th intercostal, down to the line of the ribs here. And then I'm going to go ahead and percuss the spleen to see if I hear. You normally shouldn't hear any dullness in the 7th intercostal space. No dullness noted. And then I'm going to go ahead and start doing some light palpation of the abdominal wall. And this is just to see the tone of the abdomen. This is also looking for any enlarged organs, looking for any masses. And then I'm going to go to deep palpation. Here I'm going to press a little harder, again to see if there's any masses. I'm going to check on the liver by the hooking method. Take a deep breath for me. And go ahead and let it out. And I don't feel it hitting against my hands, which would indicate enlargement. I'm going to go ahead and see if I can palpate the spleen. Not being able to palpate the spleen. And then see if I can palpate the right kidney. And it's not palpable. Alright, and then see if I have any pulsation with the aorta. And try to estimate the size. And I'm actually not able to palpate that. Okay. Now I didn't have any pain with deep palpation, but if he did, I would check for rebound tenderness, which would be if I push down and let go, he would have extreme pain. And then we would check for CVA tenderness, which is costovertebral angle. So if you can sit up for me on the side of the bed. All right, and then costovertebral angle, we're checking for any pain in the kidneys. Tell me if you have any pain. Pain? Any pain? Okay. And we are done with the assessment.